This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, April 28th, and I'm Zach Caruso. Our lead story this week is in the Journal of Addiction Medicine and is titled Outpatient Direct Initiation of Injectable Buprenorphine in a Harm Reduction Agency and Primary Care Clinic, a retrospective case series. Initiating weekly long-acting injectable buprenorphine without prior sublingual buprenorphine or direct-to-inject or DTI may reduce buprenorphine initiation barriers. In this case series, outpatient DTI outcomes are described. Of the 23 patients with available data, 19 had no withdrawal symptoms pre-DTI. Of the 20 patients with documented post-DTI withdrawal symptoms, 3 had no withdrawal, 12 had mild, 4 had moderate, and 1 patient had severe withdrawal. 30 days post-DTI, 14 patients were retained on any buprenorphine formulation, and 11 patients were retained at 90 days. The median number of post-DTI buprenorphine treatment days was 77. The majority of patients had no pre-DTI withdrawal symptoms, no or mild withdrawal symptoms post-DTI, and were retained on buprenorphine at 30 days post-DTI, with nearly half retained at 90 days. DTI is a promising buprenorphine initiation strategy, but further research is warranted. Next is an article in Addiction and is titled Association Between State-Level Kratom Regulations and Poison Center Reported Severe Medical Outcomes and Healthcare Use, a United States National Analysis. Kratom use has significantly increased in the United States and is not regulated at the federal level. Researchers conducted a retrospective study to assess the association between state regulations and medical outcomes from kratom use. Regulation categories assessed included none, local-level Kratom Consumer Protection Acts or KCPAs, state-level KCPAs, and total bans. Between 2010 and 2023, kratom-related poison center cases increased 65-fold, and severe medical outcomes, including death, increased significantly. The only state regulations associated with a statistically significant lower incidence of severe medical outcomes, hospitalizations, and healthcare utilization were complete kratom bans. Our next article is in Drug and Alcohol Dependence and is titled Effects of Cannabis Edible Advertising Messages and Warnings on Product Perceptions Among U.S. Young Adults. The use of cannabis, including edibles, has increased significantly among young adults. Researchers conducted an online survey to evaluate the effects of advertising messages and warnings on young adult perceptions of cannabis edibles. The researchers assessed advertising focused on the taste of edibles or the psychological effects in combination with various warnings. Psychological effects of advertising were associated with higher interest in use among those with past month use, but not among those who did not use cannabis. Among those who did not use cannabis, edible-specific warnings were associated with a higher perceived risk of addiction, and intoxication warnings were associated with a lower interest in use. Of note, for adult use, only warnings had no effects. Our next article is in Addiction and is titled A Population-Based Study Exploring Racial and Gender Inequities in Polysubstance-Related Deaths Across the United States from 2004 to 2022. This study aimed to measure gender-specific racial disparities in opioid-related polysubstance use drug mortality in the United States from 2004 to 2022. The final analytic sample included 627,000 opioid-only deaths, 196,000 opioid stimulant deaths, and 117,000 opioid benzodiazepine overdose deaths. Opioid-involved deaths increased across all groups, with the highest absolute rate change experienced by non-Hispanic black men. Opioid stimulant polysubstance use deaths had the largest increases among non-Hispanic black men and women. Among Hispanic men, the rates accelerated 33% per year. For opioid benzodiazepine polysubstance use deaths, non-Hispanic white men and women experienced the highest absolute rate change. Next is an article in the Harm Reduction Journal and is titled A Systematic Review and Meta-Analysis of the Association Between E-Cigarette Use and Cigarette Abstinence or Changes in Continued Cigarette Smoking Among Individuals Who Smoke Cigarettes. This systematic review and meta-analysis concern the effect of e-cigarette use on combustible cigarette smoking. The literature search resulted in 214 studies meeting inclusion criteria. Of these, 22 were randomized controlled trials and were included in the meta-analysis. Studies of the effect of e-cigarette use on the number of combustible cigarettes smoked per day found a significant mean reduction of 4.7 combustible cigarettes at 6 months. The authors conclude that e-cigarettes are effective for smoking cessation and reduction in number of cigarettes smoked. Our final article is in the BMJ and is titled Prenatal Exposure to Buprenorphine or Methadone and Adverse Neurodevelopmental Outcomes, Population-Based Cohort Study. This study compared neurodevelopmental disorders in offspring exposed to buprenorphine or methadone during pregnancy. Data for pregnancy and offspring came from Medicaid records from 2000 to 2018. The risk of any neurodevelopmental disorder due to exposure to prenatal buprenorphine compared to prenatal methadone was a relative risk of 0.81. The most common disorders were ADHD and developmental speech and language disorders. Hazard ratios for individual disorders were not statistically significant due to small numbers. The risk for any developmental disorder for patients already receiving medication at the time of pregnancy was even less compared to those who initiated medication during pregnancy. Risks were similar for exposure during each of the 3 trimesters. The authors conclude that the risks associated with buprenorphine and methadone are similar. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.